Hey guys, Dr. Heimlich here, and today we're going to be talking about Hashimoto's thyroiditis and what are the treatment options. Well, just to start off with, a lot of people still don't know what Hashimoto's thyroiditis is. That's where the body attacks itself. It attacks the thyroid gland. It also has a high propensity of attacking other different parts of your body, parts of your brain, parts of your gut, parts of your pancreas. It actually can attack pretty much anything in the body. So the thing to remember is that when you have Hashimoto's thyroiditis, you may not just be having parts of your thyroid being destroyed. Okay, so the regular medical management of it for people with Hashimoto's is what? It's to take your thyroid replacement hormone, which is needed majority of the times. Why? Because your thyroid gland is being destroyed. And a lot of times, by the time a person is diagnosed with low thyroid and is taking medication, they've had a lot of that destruction already occur in there. They start to have nodules and other things going on into the thyroid as well. So it's something you have to take. But the thing is that's just a small portion of a bigger problem, because it doesn't do anything for the autoimmune system. What's that? It's where the body's attacking itself. Taking the thyroid hormone itself doesn't slow that down. It doesn't stop the destruction of the thyroid gland. Doesn't at all. Not a bit. So what does that mean? Well, that means that you should find a doctor out there that understands what goes on with the immune system to try and modulate and downregulate so it stops attacking the thyroid. If your thyroid isn't functioning the way it should and it continues to get destroyed over the years, what will happen is the thyroid will do what most doctors would call it'll burn out or just quit, just stop working. Well, that's kind of true, but it's more like your thyroid gland just has been destroyed completely and is no longer able to function, and we keep you on thyroid medications. And most people say, well gosh, I guess when it gets destroyed and it's gone, then I have nothing to worry about. Nothing could be farther than the truth. That's not true, because you still will have that inflammation in your body. Your body's still going to be attacking the thyroid, and guess what? It could also still be attacking those other parts. Your cerebellum, that's brain. It has to do with balance, brain fog, a lot of different stuff. The gut has a lot to do with neurotransmitters, and we'll go over that in another blog post here as well. The big connection with that, I think I've already covered it before, but I'll do it again. Also goes after your pancreas, changes blood sugar levels, so you can have adrenal problems. You can have, be put on hydrochloric acid. You can be put on antidepressants. You can be put on all kinds of different medications whenever, in fact, what's going on is your body's attacking itself. And all those other things are just trying to cover up the symptoms for something that's a bigger problem. The bigger problem is your body attacks itself. It can't tell the difference. So the best thing, the best clinical management for that should focus on trying to slow down the body's attack on itself and stop it from doing that. So the best thing to do is find a doctor who understands that and is able to help manage you and guide you through to get your body to stop attacking itself. And how do they do that? Well, diet, could be supplementation. You could have some neurological things going on in your system. You could have some blood sugar issues. You could have some anemias going on. You could have some type of parasite and or bacterial overgrowth that is causing inflammation in your body and perpetuating everything that's going on. Not necessarily causing the problem, but certainly adding to it. And you need to take a look at everything all together at one time, and that way you can get the best chance of getting your life back and having your relationships and being able to go out and do what you want to do and having your hair grow back and no longer being fatigued and tired. I see people every day that just their medical history screams that they have Hashimoto's, and they don't get tested. So go get tested. If you think you maybe have it, it's easy to do. Get your antibody tested, and it's going to let you know if you have it. So if the antibodies come back positive, then you've got it. Or just 85 to 95% of the people who do have low thyroid in the United States, they have it. So there's a huge chance that you already have it. And your doctors know this too, of course. But the regular, like I said, medical model, insurance model is to treat it through just thyroid replacement hormones. And again, if that was a model that worked, you wouldn't be watching the internet right now. You would be feeling great and out playing with your family and doing the things in life that you enjoy doing. I'm Dr. Heimlich. Have a great day.